Hello there. Thank you for joining me once again on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We continue our discussion around the COVID-19 pandemic, how it affects you, how it affects me, how it affects our country, those we love, those we care about, our friends, our neighbors, not just in Guyana but around the world. As you know, it is taking a severe toll all across the globe, and hundreds of thousands of people have lost their lives to COVID and the COVID-19 pandemic as we speak. In Guyana, unfortunately, over 270 persons would have lost their lives, and that means 270 families were really thrown into mourning because of this deadly pandemic. If you have any questions or comments about COVID-19, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. As usual, I start off by wearing my mask to cover both nose and mouth, but I'll take it off now so that we can have a clearer conversation. There is no one close to me that is less than 6 feet, and so I'm putting no one at risk, and no one is putting me at risk. Recently, we have had significant number of persons asking the same question relating to pregnancy and the COVID-19 vaccine. I have addressed this a couple times, but I'd like to once again put out the summary of all that we have said about COVID-19 vaccine and pregnancy. And the same statement will hold true for any vaccine that we have available in Guyana. The Pfizer and Moderna are not available in Guyana, at least not yet, but those are the ones we may be seeing on the North American news feeds that many of us watch and follow. What we do have in Guyana are AstraZeneca, we have the Sinopharm from China, and the Sputnik vaccine from Russia. One other major vaccine that is available in the world, the Johnson & Johnson vaccine, is not yet available in Guyana either. I can tell you that there are several other vaccines being studied and used around the world, but we do not have access to those, and I'm not sure when and if we will actually have access to those vaccines. So let me summarize again everything that we would have said about the COVID-19 vaccine as it relates to pregnancy. The disease itself, COVID-19, seems to cause more harm in pregnant women than in people of the same age who are not pregnant. So let me explain that a little bit. If you have a group of women who are all in their 20s and 30s, half of them have COVID and the other half, all of them have COVID, half are pregnant and the other half are not pregnant. COVID-19 seems to affect the half that is pregnant much more significantly than it does the half that is not pregnant. So the disease itself has a more severe course in pregnant women than non-pregnant women. The next thing I want to say about this is that the risk of getting COVID-19 vaccine during pregnancy are thought to be small, but are not yet fully known because a number of trials are still ongoing that will evaluate this particular finding. For each individual pregnant woman, you should consider your own personal risk of actually getting COVID-19. If your personal risk is high, for example, if you are in an area that has a lot of COVID-19 cases, or you're a frontline health worker and you happen to be pregnant, then you are at high risk for getting the COVID-19 disease, and you should be taking the COVID-19 vaccine because it makes more sense that you are at higher risk for getting COVID infection. Of course, if you have any doubts and you need further clarification, it is always encouraged and advised that you continue to have discussions with your healthcare provider, whether it's your midwife, your gynecologist, your obstetrician, or your community family practice doctor, or anyone that you have access to in the healthcare professional. The International Organization of Obstetricians and Gynecologists have actually had a position on this. They consider that there are no risks, whether actual or theoretical, that would outweigh the benefits for pregnant women to get COVID-19 vaccine. There are no risks that outweigh benefits against COVID-19 vaccination for pregnant women. And that not only for pregnant women, but also for women who are breastfeeding. So the second question in this area that keeps coming up again is the COVID-19 vaccine and its effect on breastfeeding. The Society for Maternal Fetal Medicine reports that there is no reason to believe that the vaccine affects the safety of breast milk. And that is probably the most important thing that women worry about, the safety of the breast milk that they are providing to their child. When we have an infection or get a vaccine, our bodies make antibodies to fight the infection. Antibodies are your own defense mechanisms or your soldiers, etc. These antibodies formed from vaccines that are given during pregnancy pass into the breast milk and then go to the baby to help prevent infections. So you're actually doing something good for the baby if those antibodies pass through the breast milk and baby end up swallowing it. Since the vaccine does not contain the virus, there is no risk of breast milk containing the virus. None of the vaccines that we have actually use live viral particles. So it is not possible for you to get COVID from the vaccine, and it is therefore not possible for you to transmit that COVID through breast milk to the baby. Both the Society for Maternal Fetal Medicine and American College of Obstetrics and Gynecologists recommend that lactating mothers or breastfeeding mothers be offered the vaccine similar to non-lactating or non-breastfeeding individuals, because the theoretical concerns do not outweigh the known benefits. There is no need, absolutely no need, to avoid initiation or to discontinue breastfeeding in patients receiving the COVID-19 vaccine. So it is safe generally from all the societies. The consensus is that women who are breastfeeding should be given the COVID-19 vaccine just as easily as those who are not breastfeeding. And if you do get it while breastfeeding, there is no need to change your habit of breastfeeding, whether it's to pause it or to stop it altogether. That's not just in America, but even in as far places like Australia, for example. Australia and New Zealand governments, they support the use of COVID-19 vaccine in breastfeeding women. Breastfeeding women do not need to stop breastfeeding to receive the vaccine. There is no evidence of any additional risk to breastfeeding women or their children from any of the vaccines that we are using currently. And of course, if you have any doubts or questions about this, there is always the chance for you to seek further clarification and advice from your healthcare provider or people in the healthcare profession, whether it's the nurse in the village, whether it's the midwife, it's the doctor at the health center, or the Ministry of Health, any one of the hotlines that you can call for support. All of these places can provide further counseling and further guidance as it relates to COVID-19 vaccination in breastfeeding women. So here are some other questions I would like to address as they come up. Should women currently breastfeeding or providing express milk receive the vaccine? Express milk is when women express the breast milk, put it in a bottle, and then the baby finds it easier to get the milk from the bottle. That happens in some instances. Once the baby is getting the milk, that's all that matters. Of course, there are some additional benefits to feeding directly from the breast, like bonding between mother and child, but sometimes that is not always possible. So the WHO Special Advisory Group on Vaccination, etc., has recommended that if a lactating woman is part of a high-risk group, high-risk like in health worker, or part of a group that is recommended for vaccination, that we should and we can offer vaccine. Therefore, healthy individuals currently breastfeeding or expressing milk can receive the vaccine. Because breastfeeding is vital to the health of babies. Research on COVID-19 vaccines did not include breastfeeding women or consider the effects of Pfizer or Moderna that is elsewhere. However, the absence of the data does not mean that the vaccine is not safe for lactating women or their children. The WHO therefore recommends that mothers who are vaccinated continue to breastfeed after they receive their vaccination. The other thing that we need to address is what advice should women currently breastfeeding or expressing milk receive regarding the vaccine? What advice should we give these mothers? Well, lactating mothers who are considering receiving the COVID-19 vaccine should have access to all the information about safety and efficacy of vaccines. And these include the fact that breastfeeding is vital to the health of infants and the mothers, and the vaccine efficacy in lactating women is expected to be similar to the efficacy in non-lactating women. What that is saying mainly is that the effects of the vaccine in women who are breastfeeding as well as those who are not breastfeeding are expected to be the same. There is no difference in one group versus the other. The next question that people are asking in various ways is it safe for mothers to breastfeed after they are vaccinated? It might seem like we're answering the same question, but it's important for clarity here. The WHO clarifies the answer is yes, as the vaccine is not a live virus and the mRNA Pfizer Moderna does not enter into the cells, that it is biologically and clinically unlikely that there is a risk to the breastfeeding child. The AstraZeneca vaccine is not a replicating vaccine. It doesn't contain live virus. It is unlikely that this will pose a risk to the breastfeeding child. Mothers who are vaccinated should be encouraged to continue and to keep on breastfeeding to protect their infants, because a lot of the antibodies that these women have are transmitted via breast milk into baby to make sure that baby can then fight off infection on his or her own should they encounter infection. Does the ability to continue breastfeeding or provide milk change after a mother is vaccinated? That is, can or will the vaccine decrease milk supply? And here is the clear answer. It is highly unlikely that vaccination will have any impact on the woman's ability to make breast milk. And of course, the WHO does not recommend stopping breastfeeding after taking the vaccine. So I hope this would have helped us to understand quite a lot more about the effects and the actions to be taken during or after a vaccine has been given to women who are breastfeeding in particular. We know that it is safe and it does not affect breast milk production and it does not cause sickness or disease. In fact, it is actually protective for the child. So thank you once again for watching and listening to this program. And remember, if you have any questions, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again.